So I'm a cardiologist by background, and for the last 8 years, we have moved into this value-based healthcare approach. And then I decided to start Academia VBHC and Mak Valor Mentoring, which are two companies fully dedicated to value-based healthcare education, research, and implementation in Brazil and Latin America. And what we have as a goal is to help organizations to connect with the value-based healthcare core principles and collecting outcomes and measuring costs and looking at a new way of delivering care, which should be more integrated. And we also consider that we as healthcare professionals have not been trained in that approach. So our mission is, how can we bring the core concepts, but also how can we help implementing value-based healthcare, which should be adapted to our own local context. We have been working with different contexts, like with providers, with payers, and we also try to bring the patient perspectives, applying not only measuring outcomes systematically in all our projects, but also we have been doing experience groups, which is a methodology developed by Professor Elizabeth Teisberg and Scott Wallace. And I have been presented to this methodology during my master's program in the Value Institute for Health and Care. In this methodology, we invite patients with specific medical conditions and we bring them together to share their experiences. And we learn how their journey has been from the first symptoms into the treatment and rehabilitation, but also what do they expect as the outcomes that are really important to them. So we need that perspective in order to, first of all, understand the care journey, second, to understand the outcomes that are more important to them, but also to refine the metrics that are more important to these specific populations that we are serving. So all these challenges become even bigger when we consider the elderly population, because they have multiple comorbidities, and you know that it's not feasible for you to think of the IPU, the Integrated Practice Unit concept, considering that they would go to, for example, diabetes, and then they would go to the IPU for hypertension, and then they would go to the IPU for any other condition. So we really have to think broadly when we talk about the elderly, from the healthy aging, which is a context, to persons with multiple conditions. And then we should build IPUs not around each specific medical conditions, but around patients who have multiple medical conditions, and be able to coordinate care and be able to get families and healthcare professionals to work together to reach the outcomes that are important to this segment of the population. So I'm here to invite you to join us for a panel discussion to address unique needs for improving outcomes for older adults during the ITEM Conference 2024. And why is this important? Because all health systems are affected by rapidly increasing aging populations, which also have growing rates of complex, co-occurring health conditions. For this panel, we have invited leaders on 4 continents to share their unique perspectives on challenges and creative solutions being applied to important goals like health aging, managing medical complexity and risk, and considering end-of-life outcomes that are important to these individuals and their families. And I'm pleased to have in the panel Erin Cook from Canada, Lundi Niati from South Africa, Dr. Oscar Zanutto from Italy, and Professor Chin Earn Lee from Singapore. I'm really looking forward to welcoming you in Amsterdam on October the 22nd. So I'm really thrilled to be invited as a speaker to ITEM because I think this initiative really changed the way we look at outcomes and gave us a tool for starting this understanding of the importance of asking the right questions and also of standardizing the questions. If we do not do that, we will not be able to compare. If we are not able to compare, we are not able to improve. So I do think that going to ITEM conference is really an opportunity to meet like-minded professionals, but also to share and to connect. So I'm really thankful for being invited.